I'm so excited to be with my friend and colleague, Dr. Emily. We are both primary care physicians and passionate about health and all things prevention. So, with it being Diabetes Awareness Month, we decided to talk to you all today about
Hmm.
diabetes awareness and action steps that we can take. Yes, and we actually decided to talk about breaking the cycle of diabetes. We know that
Yes.
diabetes is very common, and there's a
Hmm.
strong genetic predisposition, and there are also lifestyle habits that tend to run in families. So he said this would be a good time to have that discussion.
Yes, I agree. And I just wanted to thank you, Dr. Akita, for inviting me on to have this important conversation to educate our communities. So let's
Yes,
get to it.
yes. We actually met in residency. We were
Hmm.
both family medicine trained doctors. We trained together, and we've been treating families.
Yes.
We've been treating families, and diabetes is something that we see commonly comes up. And there is a genetic predisposition. We take a
Hmm.
family history for a reason. And most
Yes.
of the times when we're meeting new people, we're taking the family history. People know who had what, but the holidays can be a good time to kind of dive into what are some of the updates? What are you dealing with? How can we support each other?
Yeah, and it's really not about shame. That's what I see a lot when we talk to patients. Either it's, well, we really don't talk about that in my family, or if you have a new diagnosis of diabetes, that people really take that hard. It's more about educating you about being aware and how can we change things for not only ourselves, but those coming behind us. So I'm really excited to talk about this.
Because even thinking about my own family or thinking about families that I see, we're seeing people diagnosed younger and younger. It used to
Mm-hmm.
be, you maybe a grandparent had it
Mm-hmm.
during like their 50s or 60s, but I'm definitely seeing more people in their late 20s, 30s,
Definitely.
40s being diagnosed.
I agree. And again, having those conversations early, of course, you don't want to, tell a 10-year-old your entire health history because they won't understand, but making sure that your children, as they age, even as teenagers heading into adulthood, one, that they know how to talk to their doctor, but two, give them that information and say, hey, I have diabetes, or, your grandma had diabetes. I worked really hard to try to prevent that is something that you need to be aware of because I really remember the old um, thing that used to come on TV and it was knowledge is power. That is
But
still
yes,
true.
yes, it is. Yes, it is. Well, Dr. Emily, let's talk about why diabetes runs in families.
Sure. So there really is a genetic component and there is environmental factors, right? You hear a lot about, nature versus nurture. And so genetics are the things that you can't control, right? So it's your genes given to you by mom and dad. There's
Yeah.
nothing that you can do about that. The genetic part of diabetes really it depends. With type 1, there's definitely a higher genetic predisposition than type 2, but people think, oh, well, type 2 is just based on what you're eating. And that's not necessarily true. There
Right.
is a chance that, okay, because mom or dad have type 2 diabetes, that you could also develop it, even when you're doing the right things. The bigger piece of that part, though, is environmental. What are you eating? How much sugar are you eating? Are you exercising? So there are a lot of things that come into why you may develop diabetes. Also, your stress response, right? Because the stress can also cause that predisposition for diabetes to rear its ugly head and then access to medical care. And I know that you have some things to add to that part of the conversation.
Yeah, as you were talking, I was thinking about the environment that is the environment in which we live and how that
Correct.
affects the environment of our bodies.
Mm-hmm.
And in my head, I was imagining the imagery because we do inherit these genes, but our
Right.
lifestyle choices turn the genes on or off. And we
Mm-hmm.
often see cited that for chronic disease, maybe like 30% is due to genetics, right?
Yeah,
That gives us a great opportunity because 70% is related to what we eat, drink, how we sleep, how we play, what
that
we
is
do
correct.
on our lifestyle choices. So that is a place where
Mm-hmm.
we can take action. Yes, we may have inherited these genes, but let's choose foods that support our health. Let's participate in routine physical activity that support our
Right.
health. like all the lifestyle choices, 70% is a big area that we can make an impact.
Yeah, and that's a great segue into we have the holidays coming up, right? So
Yes,
what are some
yes.
things as far as let's talk first about, if you're not sure about your family's medical history. So Thanksgiving and Christmas, families are getting together. So how do you go about finding out your family's medical history? What are some thoughts that you have about that? Because I have a few, but
I was just thinking about some of the people in generations, above me, like aunts, uncles, grandparents. When I
mm-hmm.
start asking, and I'm a healthcare professional, but when I start
Right.
asking, it's kind of like you have to kind of tiptoe because some
Mm-hmm.
people are private, and that is
Right.
fine. But I do think this situation, we need a safe area we can share because it
Mm-hmm.
helps in the long run. So, just approaching it in a place where I'm trying to make sure I know what's going on in the family for my
Right.
health and for my
Mm-hmm.
children's health, my cousin's health, or any changes, any new medications. I
Right.
kind of get to it because I know what I want to know. But
Right. Yep.
what
Yep.
are some ways you think people could approach that?
Well, I think one, to your point, being careful because it can be a touchy subject. So one recommendation would be, as you sitting around, of course, you cannot be judgmental and be like, Auntie, you shouldn't be eating that pie. I do things like that. Don't do that. But you can say, I'm getting ready for, my physical, or I'm changing
Yes.
doctors, whatever the case may be. I have an appointment coming up. And I'm not real clear on some of the health problems that our family has. Can somebody share that with me? Because that way you're not directing it at, say, mom or dad or your aunt.
Yeah.
Then that can really encourage the conversation, so that you can take that information back to your doctor and know for yourself. So that's one way to do it, making sure you're using non judgmental language. Frame it as you're wanting to make sure for your health that you're wanting to be healthy, to make sure what you need to be aware of. And I think that will encourage conversation.
Oh, yes, yes. Um, in thinking about families gathering, I was
Mhm.
also one of the favorite things I do now during clinic is I'm like, well, who's cooking?
That part.
What y'all eating?
Hmm.
Because
Yep,
as
exactly.
yeah, maybe not at the dinner table, but in preparation for the menu, when we're thinking
Right.
about what is going to be served, how many proteins, how many carbs, how many
Hmm.
vegetable opportunities, because as we also pass on genetics, or
Right.
as we inherit our genetics, we also inherit our lifestyle
Our
practices,
habits,
our
right.
eating patterns. Yes. And
Yes.
that plays a big role because for a lot of people, diabetes is not just the genetics.
That's right. And that's a good point because, we're quick to ask, who doesn't eat pork or who's vegan or
Yes.
who's this. So as you're asking those questions, yeah, you can say, oh, well, I've started trying out, a low sugar version of sweet potato
Yes, yes,
pie,
yes,
or
yes.
I have started cooking with less salt. That way, that will also encourage some conversation because, again, it's easy to ask, well, who doesn't eat this? We never kind of take it a step further and say, okay, what about the sugar content, the
Right.
salt content? Are we having sodas, or are we just doing water? Maybe some low sugar lemonade, things like that. So that's an easy way to add that into the conversation with the family as you all are preparing your meal.
Yeah, and I think that also gives people opportunity. Oh, you eat low salt too. Why are you doing that? Oh, because my
Hmm.
doctor said, and that can
Yes.
encourage a nice, natural conversation and then support each other in your health. In your health.
Absolutely. Absolutely. And the other piece that will help tie into is, okay, so what are y'all doing? We know on Thanksgiving, right? After the meal, you might have your food coma and be ready
Yes.
to take a nap. And I know some families who may do things like karaoke, they may go out for a walk. So also figuring out how to incorporate a little bit of that exercise that we talked about into your Thanksgiving or Christmas holiday tradition whenever your family gets together over the holidays.
Oh, yeah. Yeah, that's really good. It reminded me of one year my family and I did do a walk after the meal. And that
Mm-hmm.
was a way, thinking about diabetes awareness, that was a way for us to control the sugar
Mm-hmm.
in the blood, just to kind of exercise it out. It was
Yeah.
good.
Yeah, and it's good, and you can frame that as, hey, you guys, let's have a new tradition. This year after we eat, instead of immediately taking the nap or immediately going down to watch the game, depending on what time you eat. Now, we're not going to get into what time people say they're going to eat dinner and what time they end up eating. We're
Versus.
not going to have that one. But saying, okay, well, let's do this 10 minutes. We got all the kids here, let's take them out and let them play kickball. Or let's if you have a family member that has a dog, okay, well, let's go walk the dog real quick. There are easy ways to get, even if it's just 10 or 15 minutes, having that exercise during that day would be helpful. What's your thoughts on like hydration? Because I know some people, especially the women in the kitchen cooking, don't always stay hydrated. So, how can people kind of stay hydrated during this time?
I think, there are those cups that help you drink at this time, drink at this time, drink at this
Mm-hmm.
time.
Oh, that's
So whether
good.
you're using that to kind of mark the time and see if
Mm-hmm.
you're meeting the goal, or
Mm-hmm.
just, if you're thirsty, it's already too late. So, standing
Right.
in the kitchen, cooking, being hot, just being
Mm-hmm.
aware. And to
Right.
your point, if it's a shared experience, they're in the kitchen, they're together, having
Mm-hmm.
the things readily available to drink water, because we
Right.
even know with blood glucose control, relative
Mm-hmm.
dehydration makes the sugar higher. Not that
Yep.
it makes the sugar higher, but it leads to higher readings. So
Yep.
hydrating is important for blood sugar control.
Yep, definitely. And that's a great point to kind of plan if somebody is cognizant of, okay, I don't know if y'all got a big mama out there, but big mama's cooking. We got to make sure that big mama got a cup of water or something next to her, preferably not something with high sugar, like, your
Right.
sweet fruit juice. You don't want to drink your fruit. You want to have that healthy fruit to get the full benefit. But making sure that big mama and all the aunties cooking are staying hydrated. And that could also be part of the tradition, to your point. If everybody has that cup and it's 11 a.m. and their water count is still at 7 a.m., then it's like, okay, y'all, it's time to take a break and drink your water. So there are easy and fun ways to kind of introduce new traditions that will be healthier, that are not just, oh, we're not going to have sweet potato or pie, or we're not going to do this, that, or the third. So the exercise and the hydration components are really important, especially in the setting of diabetes.
Yes. This conversation has reminded me, when I was younger, it was probably like an adolescent, but we were
Mm-hmm.
gathered as a family. And there was one cousin in particular that had these symptoms going on. And I remember it clearly because he had lost a lot of weight. So when we all showed up, we were like, oh, you lost weight. Like it was
Mm-hmm.
a good thing. We were congratulating him. And I remember
Mm-hmm.
he was really thirsty. But guess what?
Mm.
It was new onset diabetes.
Diabetes.
So that's
Mm-hmm.
because it was something that we noticed as a family, but I was younger and I guess others did not pick up on maybe this weight loss and this
Yeah.
thirst were not the healthiest things, right? So when
Yeah.
we think about those we may not have seen in a while, or even people we
Mm-hmm.
may day to day, there are signs that can be picked up and symptoms
Mm-hmm.
that maybe the blood sugar is not controlled. So
Right.
rapid loss without major changes in like
Mm-hmm.
lifestyle patterns, increased thirst, increased urination. For some
Mm-hmm.
people, people even say like blurred vision or just
Mm-hmm.
foggy thinking.
Yeah.
Those are things that we can pick up on. Any
Yeah.
other thing out to you?
I think those are really good. The only thing I would add to that list, which was great, was I've even had people, especially women, who have had yeast infection,
Oh yes, yes, yes.
issues with sleep, a lot of those, sometimes fatigue, and sometimes those symptoms are really vague. So this is, of course, you're talking to two primary care docs. So I'm gonna just throw this out there. This is why it's important to have a primary care physician that you
Yes,
can
indeed,
come to
yes.
and share all of these symptoms that you're having, because part of what we're going to do is look at, okay, big picture, what's going on, what are some of the big things we need to rule out. Diabetes is always on the list. It is
Oh,
always
it
on the list.
is.
Yeah.
It is.
Yeah.
And if you go to a primary care doctor, and then your family history, that's what we started off
Mm-hmm.
talking about, and you're
Mm-hmm.
saying you're having these symptoms, it's going
Yeah.
to be, you said, high on the list of things to evaluate for.
Yeah. So we talked about some of those, they call them silent precursors because you
Yes.
you may not be aware that some of these things are going on in the background. Again, it's a good reason to have regular appointments with your primary care doctor. But what are some of the other metrics that matter, if you will, is when you're talking about someone who's been diagnosed with diabetes? What are some of those things that are important that you talk to your patients about on a regular basis?
Well, I usually start with lifestyle. So when we talk about
Mm-hmm.
metrics, I think about like nutrition.
Mm-hmm.
And then I talk about like the food groups. So protein, carbs, and the vegetables, green leafy vegetables. And
Mm-hmm.
one thing that I'm trying to do more and more is encourage people to eat in a particular order.
Mm-hmm. Mm-hmm.
Mhm.
I like that.
Definitely not starting with the carbohydrates. So when I'm
Right.
talking about meals, I usually start with saying, well, what did you have for dinner the night before? And then
Mm-hmm.
I'm listening for what is the protein, what is the carb, what is the vegetable, and
Mm-hmm.
encouraging to eat protein or vegetable first and then carb last, because
Mm-hmm.
that will affect how their body absorbs sugar. And then
Yeah.
we're talking about metrics, things you can measure. I encourage routine blood sugar measurement,
Mm-hmm.
maybe even with a continuous glucose monitor, because it makes it easy. I have on
Right.
one now and I can look at my phone. And so you can do these, I don't want to say experiments, but you can do these trials with yourself. Like if I eat in this order, this is
Right.
how my sugar reacts.
Will
If I
react.
get a
Mm-hmm.
good night's sleep the night before, this is how my sugar is the next morning. If I keep my
Mm-hmm.
stress level low, this is how my sugar
Sugar.
is. If
Yep.
I
That's true.
exercise, this is how my sugar is. So when we're talking about metrics that matter, having
Yeah.
diabetes, the sugar day to day matters because that is
Yeah.
going to influence the A1C,
Mm-hmm.
which is measured
That's
every
good.
3 months.
Every 3 months. Mm-hmm.
But
That's
when
real.
you go to, mhm.
Yeah, oh, I was just gonna say that's really good because just thinking about the order you're eating the food, that's not something I necessarily have thought about. I always talk about your balanced plate, right? And I know
Yes,
everybody has
yes,
seen, what the plate looks like, and people still look at me like, what you mean? Where half of the plate is usually green and colorful. So the more
yes,
colorful
yes.
your plate, the healthier it usually is. We talk about the white stuff, the white rice, the white bread, the white potatoes. Those are going to be
Yes,
higher in your carbs. So definitely it's good. And I'm going to add that, eating the fiber and the protein first before the carbs because that'll help. On top of, okay, let's look at your plate. If your steak
yes.
or your chicken takes up half the plate, that's too much. So that's really good information.
Yeah,
Yeah.
I find that when I'm talking to people every 3 months about their A1C, it's
Mm-hmm.
hard to pick out what made the improvement versus, or maybe
Right.
what made it worse. So having
Right.
those day-to-day readings,
Mm-hmm.
hour-to-hour readings, are very helpful to know how the individual reacts to
Mm-hmm.
the cup of rice versus the cup of potato
Right.
versus the high glycemic fruit. So
Mm-hmm. Mm-hmm.
yeah, that's
Yeah.
a metric I like. So that's what would be one that matters to you.
Yeah, that's good. When I'm talking to people, whether it's at the 3 month follow-up, it is trying to get okay, tell me what the typical day is as far as eating for you, especially if they don't have the continuous glucose monitor. So
Yes.
then we work with, okay, this is how you should track your blood sugars. If their diabetes is pretty well controlled, I typically will have people check that fasting reading first thing in the morning. You haven't eaten anything for
Yes.
at least 8 hours. But for people who are really trying to understand how their body responds to food, the biggest thing I tell them to remember is don't check your blood sugar unless it's been at least 2 hours after you've eaten, because
Yes,
your blood
yes.
sugar is going to spike because you just ate. So people get really discouraged. Oh, I ate this and my blood sugar was still high. The very first question is, how long after you eat did you then check your blood sugar? Because a lot of people don't know that they need to wait to let the body process it to really get a true evaluation of how that affected their blood sugar. So that's one of the big things that I find myself educating people about over and
Oh,
over.
yes.
Hmm.
Yes. That's one of the reasons, as you mentioned earlier, like maybe the family walk after the holiday meal,
Yes.
because those 2 hours after can really
Hmm.
help your body process that sugar. The more you
Yes.
move the muscles, that signals
Hmm.
the muscles, let me use the sugar from
Yes.
the bloodstream for energy. So that can
Definitely.
affect the positively affect that 2 hour postprandial level.
All right, so I think we have really kind of gone through it, and this was a quick hit, everybody. This was not meant to tell you everything about diabetes, but we wanted to kind of talk about heading into the holidays. So, what are some of the things as we look at, the family challenge and the holiday reset? What are, maybe three things that you feel like are important for people to know about diabetes as they go into the holidays?
Um, well, knowing that family history matters, but your lifestyle can almost matter more. So not
Hmm.
feeling defeated just because everybody has it or runs in the family. You
Right.
definitely have the ability to break the cycle and
Hmm.
change that for your lineage beyond you. So that would be number
Yes.
one. Number two, don't underestimate the importance of sleep. I say under
Agreed.
more. Sleep or the lack thereof affects metabolic health in a way that we
Hmm.
don't really appreciate always. And so prioritize sleep. And then the other thing would be stress management, to do your best to manage your stress with the tools that you have, whether that is taking the walk
Yeah.
or yeah, getting proper sleep or just talking to somebody about it. Because the holidays are full of good times, hopefully, but for some it may be challenging. And so stress management.
Yep. Yep, I would add to that, looking at adding those, which you kind of already talked about, adding that new tradition to your family, whether that is the physical activity of taking a 10-minute walk right after you eat, or even introducing a new recipe that may be lower in sugar and lower in salt to your family's meal options, and really having that conversation to introduce it that way is not a in a judgmental way. Is, hey, I'd like for us to try something new. I'm still going to make this, but I'm going to make it with a little less salt or less sugar depending on what you're talking about. The other thing that I would like to ask people to remember is to hydrate. When you're getting
Yes.
busy with the family, you're cooking, you're preparing meals, you're sitting around eating, don't wait until dinner at 5 or 6 o'clock before you're really getting in a good amount of water. And sometimes with dinner, we might want the soda or you might want the sweet tea, but you haven't given your body the water all day. So those
Yes,
are two
yes.
that I would just add on to what you shared that's important as we go into the holidays and making them a little bit healthier for our families. Well, I have really enjoyed this conversation with you, Dr. Keita. And listen, I want to leave you guys with just one line of encouragement and hope. We have the power to change our family's destiny. It starts with one conversation, it starts with one meal and one walk. So just remember that as you're going through the holidays.
Yes, yes. So to that point, please comment below what your new tradition will be and share this
Hmm.
video with your family. So thank you, Dr. Emily, for joining me for this conversation. I always enjoy the opportunity to connect and to help empower others and support each other. Feel free to follow me at Dr. Akita Evans on Instagram or connect with me here.
Thank you so much for having me. And I'm just excited about our future collaborations and hope that you guys will follow us on this journey to improve not only your health, but the health of your families. And if you would like to follow me on Instagram, I am Friendly Neighborhood Family Dog, just like Friendly Neighborhood Spider Man, but Friendly Neighborhood Family Dog. And we look forward to connecting with you guys again soon.